going to go back to my medical oncology colleagues. This is now about BRAF V600E positive disease. Okay. We have options like chemotherapy, immunotherapy, targeted therapies for patients whose disease harbors a BRAF V600E mutation. But what if the patient has gone through all of those three options? They've gone through the targeted therapy, they've gone through chemo, they've gone through immunotherapy. What do you recommend? Are there trials for these patients?
So again, it's very important when we're talking about targeted therapy and driver alteration positive non-small cell lung cancer is to try to understand the resistance mechanism. A lot of times in most of these driver alteration positive, but particularly or as an example in BRAF, the resistance mechanism can be in that RAF-MEK pathway. In terms of clinical trials, yes, there are a lot of trials for what we call like pan-RAF RAS inhibitors. So these are inhibitors that inhibit the pathway from kind of downstream to cover the resistance mechanisms that can be the reason why the cancer is progressing on these targeted therapies. So that's one type of drugs that are in clinical trials. There are other drugs that are either in newer combination of immunotherapy, sorry, like newer immunotherapies or ADCs or bispecific antibodies. So in that situation, I will definitely be looking for a clinical trial, particularly, preferably a targeted one, but there are some other clinical trials that would be interesting.
Dr. Patel?
Yeah, I would echo that. I think the number one thing right now would be advocating for yourself to find a clinical trial. I know part of the times it's really hard if you don't have a big academic institute that might be close to where you live. How do you find these clinical trials? How do you look at these things up? And, it's a very confusing thing, but clinicaltrials.gov is a great place to start. You can usually put in your mutation and your diagnosis and be able to see, like, region-wise you're only able to go, for example, I'm in Texas, so I'm only able to be in Texas. Like, what are my options? And I do think that the pan-RAF inhibitors and the ERK inhibitors are probably the things that you want to be looking at for the resistance that we're seeing in the BRAF V600E patients.
Yeah, so I'll just also emphasize repeat molecular testing, making sure that you're checking for those proteins as well if you do have progression of disease on the three treatment options that were already displayed. And there's also ADC trials as well in this setting too.
One,
So
one more thing, also look at the patient advocacy groups,
yeah.
particularly in BRAF bombers. They are very well versed with, the clinical trials that are available, and they have, very good connections with experts in the field, so they
Mhm.
can connect you with someone who has a trial either in your area or elsewhere.
Thanks.